Hey, this is Dave, the Caregiver's Caregiver at caregiverdave.com, coming to you on the number one rated caregiver podcast on the internet, along with my lovely co-host, best-selling author, and former mayor of Grover Beach, California, Debbie Peterson. Say hello, Debbie.
Hello, Dave. Hello, Tony.
How are you doing, Debbie? You need to come to Texas and be a mayor.
And we have an especially exciting show planned for you today. Toni King has more than 20 years experience as a top sales leader in Medicare planning. And this is open enrollment right now, guys. So when Toni saw the recurring theme of confusion as it relates to understanding the rules of Medicare for choosing, she just had to come on my show. And so here she is. Toni, so great to have you on the Caregiver Day.
How are you doing? It's good. I'm going to turn my volume up so I can hear you a little louder.
Sure.
There you go. You got it.
So let's get right into the questions caregivers have on their minds. I was just saying with Debbie, you and I spoke before the show, and you were saying how things are going to change because of the, the Inflation Reduction Act. Talk about an oxymoron about the name of an act that has a totally opposite. Oxymoron. Thank you.
It's worse than an oxymoron.
Yes. So I just saved 70% on my drug plan just by going on Medicare.org and .gov. Sorry, yes, .gov. I'm giving a lot of misinformation here. And, every year the same thing happens, open enrollment, and I look and I'm confused and I'll just keep what I got year after year after year after year. And, they're ripping me off. United Healthcare, the drug plan there. And so I got this other plan that's 70% cheaper.
I commend you, Dave, because oddly enough, at 9:30 this morning, I had an appointment with the gal who works for a volunteer organization in California. And when I first started on all of this, I just went to her because I could not interpret it. And
you also called me. And I tried to help you.
Yes, But I called her years ago. So she's like, we're on about year 4. And so I just got my stuff sorted out for this year too.
Well, I tried that one time and you fill out this thing and then 50 million people call you, and it's like,
oh no, this is just one person. That's an advertising thing. This is an organization that exists to help. It's not there to sell you plans.
Well, they're going to be overloaded this year because
they are. She's already saying
really that changed.
But Toni, what are the biggest? I'm amazed that I did this by myself on Medicare.gov.
Oh my.
Well, I'll check here. You're going to give me your Medicare.gov username and password, and I'm going to go on it and make sure that we're going to do it together and make sure that you did it properly.
And if it is a bad plan that I picked, so I called them up and they says, well, Medicare.gov doesn't always give the right prices. That's why I want to double check this. I says, really?
Well, but they can change their prices during the year, but we need to tell, since this is going out and Medicare open enrollment opened up last Wednesday, October 15th, I have never seen changes like what they are doing. So what's happening is everything that has taken place starting January 1st is because of this little bitty bill that was signed about 5 years ago called the Inflation Reduction Act.
Yeah, and then inflation actually went up, right?
and they took out, last year they helped with insulin. Okay, they made the insulin very inexpensive.
Yes, they kept bragging about that.
But this year we got 10 prescriptions. We have Eliquis, Xarelto, Januvia, Jardiance, Farxiga, Entresto, Enbrel, something called Ibuprofen, so I can't really pronounce it, Stelara, and Novolog, that's an insulin. Those are the 10 drugs that Medicare went to the manufacturer and made them lower the price. Now everything has escalated. There are Medicare Advantage plans nationwide that have dropped their PPO plans. They're all going HMOs. There's very few PPO plans. So if you're in a Medicare Advantage plan and you want to make a change, talk to your doctor and find out which plan they're going to be in. The call centers doing this are from the Philippines, Jamaica,
oh my God,
wherever, India, all over the place. They don't have our insurance. So they don't know what it takes.
Well, what's the biggest questions that you get asked? Let's start with that.
The questions I get asked? Well, my clients right now, because I'm an insurance agent, that's how I got started doing this.
Nationwide, you can do.
Texas is big enough to keep me busy.
All right.
Okay. Nationwide, Medicare is nationwide. So I can go nationwide and sell whatever I need to enroll somebody in. But I have never seen the changes in the prescription drug plan since it got started in January of 2006. I don't know how old I was in 2006. So I'm 70, so whatever that would be. And
I'm 71.
It all started changing in 2006. That's when the Medicare Advantage plan started. And that's when the prescription drug plan started. It was all affordable. But this year is ridiculous. You see what's happened when you went on and looked at your plan. And I don't want to give out insurance companies' names because people don't need to know.
Right.
All they got to do is go online and look. I'm not here for the insurance companies. I'm here for America.
And I was just looking at the drug plans, let alone the supplement plans. That's a whole nother can of worms.
The supplement's a whole different ballgame.
I know. And so I got to look at that because I've been with this company for over 10 years.
But you may not be able to change. That's another workshop, another time.
Yeah.
Okay.
Well, my wife can't change because she has pre-existing conditions now.
Let's not go there. We don't want to get people totally confused because what people need to realize is they need to go on Medicare.gov. They need to open themselves up a Medicare.gov account and go on and research what their prescription drugs are doing. If they haven't changed a plan in a couple of years, they need to go and look at it and see what's happened. And next year, it's amazing what's going on. I saved one lady over $2,000 for next year by changing her from a plan here, the one that you have in Texas is $148, I believe, with a $130 deductible. I changed her to another plan like you're going to change to something. Hers was $22.90, but she's going to save over $2,000.
What's the deductible?
Even after she pays it. Medicare's deductible for Part D is $615. Okay. She pays $601. Okay. So even what she's paying deductible wise, she's still going to save over $2,000.
Yeah. I was paying over $2,200. Now my deductible is $615. So I won't even meet the deductible,
Yeah. But a lot of people with the Medicare Part D plan, whenever your cost, not what you're paying, but whenever your cost hits $2,100, then you don't have to pay anymore for the rest of the year. Okay. Some people, they're not going to hit that. Some people will. You'll know when you're doing it. When you're doing your prescription drug plan and you're doing it during Medicare's open enrollment, do it monthly. Don't do it quarterly. Even if you buy it quarterly, you want it monthly because you want to see when you hit that major cost of the cost. You want to make sure that when you hit the $2,100 that you get it. And that's what's real important. That's what you've got to do.
Yeah. So with a $615 deductible, for example, these drugs that you're just paying retail on these drugs, or
the retail price is what you see on the cost side. You're generally paying a copay or something. I don't know. It just depends on once you look into your prescription drug plan. But I had a gentleman, here's what my article is for this week. And I'm in some newspapers in California, some newspapers in Las Vegas. I'm in the Houston Chronicle. I've got newspapers in Florida. They carry my article. But there's a brand name drug that a lot of people take. Okay. And Debbie's going to go, what? So there's a drug called Humira. Humira is, a lot of people take it. And that drug is over $8,300. But Medicare has kicked it out of their formulary and it's not covered nationwide.
And what does it do?
Already done. I did it when you and I were talking and you told me the plan that you're on, and I put Humira in, and it would end up being $102,000 for the whole
What does it do? What does Humira do?
Humira is for people that have rheumatoid arthritis or they have Crohn's disease. So I have a gentleman that he emailed me. This is how I found this out, because I can't look at everything. I mean, how many drugs do we have? And so I looked at what he had, and I said, you need to go back to your doctor and talk to him about taking another medication. Let me tell you what he said.
Because these aren't generics, right? These are all,
no, this is a brand name drug.
Yeah.
And I said, and he goes, I can't take other meds. He has something where in his intestines, right before it comes out his colon, that it just blows up and he bleeds to death. The Humira stops that. So what you got to do if your prescription is not covered, go to the prescription drug company and see if they can help you. So he used to not take it. He used to not put it on his Part D plan because he didn't have to pay for it. Last year, he met the $2,000 with the Humira. And that kept him from having to pay a lot of money on everything else. It's really confusing. I Googled, why is Medicare not covering Humira for 2026? And you want to know what it said? I emailed it to you. It says Medicare Part D plans are not covering Humira in their 2026 formularies because they are increasingly switching to cheaper Humira biosimilars. I'm like, what is a biosimilar? So it's a drug that's like Humira, but it's less expensive. That makes no sense. So what happens if you're allergic to it? What happens if it doesn't work? What are you going to do? So you go back, you get your doctor to get you some other kind of prescription, or he can go directly to Humira and see if they will, put him on the plan that it gets paid for, or go to Canada and get your prescription from Canada.
Or Mexico.
We have people that drive down here to Laredo and go across the border and get their prescription, even if they're paying that tariff. I got somebody that's getting Xarelto. So the 10 meds that are happening because of the Inflation Reduction Act has totally changed Medicare from one side to another. And after COVID, people that have a Medicare supplement are finding out that there's rate increases because now the insurance companies, they're in a hole. They're in the negative because people are now getting the surgeries that they weren't getting during COVID. So the rate increases are coming by droves. So California, you just wait. It's coming your way.
But Trump just told me that we got on the best, what do you call it? Favored nation status on drug prices because we were paying as much as 10 times more than Europe, etc. So when is all that stuff going to kick in?
I have no idea. I don't. When it comes to Medicare, whatever the government changes, it takes 2 or 3 years to ever get into their system. So don't believe all the stuff you hear on TV. We do have drug prices. I mean, it's terrible what we pay as a nation, and we can let you lead it, Dave. As a nation, we need to stand up and say, we're not going to put up with this. I don't care whether you're Republican or Democrat. It doesn't matter. I don't care who the mayor is going to be for New York. He doesn't pay my bills. That's irrelevant. But when your mother or father or grandparent or whoever takes an expensive prescription and the whole family has to get together to pay it, we got to, not everybody is a millionaire or billionaire. And we need to stand and say, we're not going to put up with it anymore. I mean, I don't know. Where did they come from? All this started after COVID, and they all had that. They got money off of all those injections that we had to take. All those, what do you call those things?
Vaccines.
Your vaccines, and they started making all this
They
money.
they made a lot of money off of those. I mean, that should cover whatever they're going to lose now. Let them break even. Whatever.
They're not going to give anything away.
No.
The companies are, don't get me started on the companies. They're moving all their call centers overseas.
Debbie, you got any questions?
We need jobs here in the U.S.
I guess really what I'm thinking, if I'm a listener, what is it that I need to hear? What is it I want to know? What is it I need to hear? And you've talked about some of the number one takeaways, but I'm wondering if there are things that the listeners really need to know.
What the listeners really need to know is look online, like Dave looked online. Look online on Medicare.gov. If you do not have a Medicare.gov account, you've got a Medicare card. That's all you have to have. And you put your number in there. You got your you got a little question. Who's your favorite? Where'd you meet your spouse, or what's your dog's name? Whatever. You fill that out and you look at what your prescription drug plans are. And then you look at which one comes up first or second, and you compare.
They have ratings, star ratings too. Mine.
Don't go by. Star ratings are irrelevant. Star ratings are irrelevant when it comes to, because it shows you what the price is going to be.
The plan I was on only has 2 stars. The one I picked has 4.5.
Yeah.
Interestingly enough, I stuck with my plan that was 3.5 stars rather than going to the cheaper 4.5 stars, because it allowed me to keep Medicare Plan A, which in my case is more helpful. But the stars one is good, but I've never had any trouble with the plan.
Are you talking about supplement or drug plans?
We're not talking.
I'm talking drug plans.
Okay.
D. The D. Mm-hmm.
Yeah. So if anybody needs to get me. They need to call. They want to get me.
The drug companies probably want to get you.
Yeah. Well, the drug company, I don't know. We'll have to see what happens. But my email is info at Toni Says, ToniSays.com. Toni Says, I've got it back here on is my website, ToniSays.com. And my phone number, if anybody wants to call, is 832-519-8664. For if they just need to ask questions. Okay, I can let people know I do charge a fee to do the prescription drug plan because I don't make any commissions off of it. And sometimes I spent 2 hours with somebody changing their prescription drug plan. So, it's very, very, very important. And after we got finished with it, she saved $2,000. Literally, that's an honest to God truth. I can have you call Pam. She'll tell you what happened. It was amazing.
One of those things you should always pay for a good CPA, pay for a good attorney, and pay for a good insurance broker.
Well, it's not just insurance. This is beside insurance. If you're if I'm making a commission, I don't charge a fee, but I go directly to Medicare.gov. I enroll everybody through Medicare.gov. I don't make a commission on the prescription drug plan, but I
saved $1,640 on my plan. I'm going to do my wife too, so that's like $3,200 a year that I'm saving.
That's buying a new car.
It's paying your property taxes. I just got a property tax bill for my condo here at the beach. Wow.
So that's it. That's what you're going to be able to do something with the money.
Okay. Let's move on to supplement plans. Is that an issue too? Or Medicare Advantage plans or supplement? Which way do you go?
It just depends on what the person's situation is and what state they're in.
Usually our favorite doctor isn't covered on an HMO. So that's why we stick with the PPO.
Yeah, but you're on a Medicare supplement.
Yeah, but that's just the what stopgap. Is that what they call it?
That's a gap. That's
Medigap. That's what a supplement
you're
is.
on a Medicare
Medigap?
supplement. I think that's another time, to be perfectly honest. I think that's another time for another talk
Right.
on how to do the Medicare supplement, because they're all state specific. Medicare Advantage and Medicare Part D are federal programs.
So
They
are you
run
taking
by Medicare?
Are you taking phone calls from people out of Texas?
Of course,
Okay.
of course. I mean,
Just said each state is
they
different.
all want to move
How do you
to
keep up with it?
Texas. We're getting enough California people down here.
Yeah.
I mean, so it's growing.
What else should we talk about? Or are we still talking about drug plans?
I just think right now the drug plan is probably the most important. And let's just say I take a generic for stress. Imagine that. I take clonazepam. And I'm on in Texas, my prescription drug plan is 0. It was a low one that you looked at. In Texas it's 0. In California it was $5. That's WellCare. Okay. So I pay 0 for my prescription drug plan, but I've got 2 prescriptions that have gone up in price. Look at GoodRx. So I can go and get it at GoodRx, go to my pharmacy here in Houston. I go to HEB, which is a grocery store. You don't have one, you need one in California, but you don't have it yet. And I'm going to pay $8. So if it's a generic drug and it costs a lot on your Medicare Part D plan, go to GoodRx, go to Single Care, look on Amazon. If your prescription is costing a lot and it's a brand name drug, get your doctor to get you a pharmacy in Canada. You can't believe the amount of money you're going to save.
How do the deductibles work? What price do they use to charge you for the drug if you're still paying your deductible? Are they
usually if you've got
generic?
right now you've got 6 tiers, and I don't know how the 6th tier is going to work, but you have 6 tiers. I'm generally familiar with 4 tiers. You've got your preferred brand, your preferred generic, your regular generic.
Take an old one like Synthroid, for example.
Those are preferred generics.
Those are preferred generics. Are they generally cheaper?
I would say $0.
So if we have a deductible on the plan and we're buying Synthroid,
your deductible generally doesn't work. It depends on the plan you have. Generally, the deductible is for the brand name drug is when it kicks in, or it can be for the non-preferred generic.
Okay, so for example, if I have a $615 deductible and all of my drugs are generic, which it says are 0, that's within the realm of possibility?
0. Then you pay 0. But if you end up getting a generic that's not preferred, it's just a regular.
So I may not even hit that $615 generic, so I'm saving even more money. I figured I was going to have to pay the $615 somewhere before they pay.
You and I are going to get together and look at what you picked, because I got to make sure you're.
It sounds like I'm going to be saving over $2,000 a month if because I'm not on any name brand drugs. It's all generic. But I'm going to be saving like $4,000 between the two of us.
You never know, and your wife takes a lot of prescriptions.
Does.
So, but you guys are caregivers. You talk about caregivers. There's caregivers out there that are working with people that are on hospice, that are in a nursing home, in a personal care home, assisted living center. They need to look at their prescriptions. They need to get in the game. That's very important. My mother was in a personal care home, made a major difference. She had her friends. She didn't just stay in her little room by herself, the whole 9 yards. It was wonderful. And my dad was a veteran. So if your spouse or your kid or your husband or whoever it is that's on Medicare is a veteran, there's special benefits through the VA that they can get. So we got the VA care where you can go into a facility. When you reach that point, my mother got like $1,400 that paid for the personal care home with her Social Security.
Wow.
I know how to work that. I've done that one too.
So, I mean, I'm a USC graduate, but I can't figure out the system. And I was very surprised that I don't know if I've ever gone to Medicare.gov, but it seemed very simple. I put in all the stuff and it compared what I have now to what I have. So I would challenge you to try that, Debbie, if you're in the
Well, I did. I don't need to. I already did it. I already looked at all of those things, and then I went to my advisor, and I have done that this week.
Did they change? Did they change it?
No, I stayed with WellCare because they're actually they're the only one that covers my medications.
Did you say WellCare or welfare?
WellCare.
WellCare. That's what I signed up for now. That's really a good plan.
They've dropped their. There's one prescription drug plan, and I'm not going to mention the name. That started. I looked at it when I did a little video in 2023. It was $6.80. In 24, it was $9.80. Last year, it was $44.80. They always keep the 80 cents. Now it's going up. Now it's going up to 90. It's gone up $50 to $94.80. And this little one is one of the big guys. It's owned by one of the big pharmacies that is owned. I mean, one of the big pharmacies kind of control it. I'm not going to say who the company is. People can call me and I'll tell them. But it's gone up 1,300% from $6.80 to $94.
I think they call that a bait and switch. Start them cheap and then.
That's a crime.
Mm-hmm.
Because if somebody does not change it, that's what they're going to pay. You know, just because a senior has a Social Security check and we have money from a 401k or whatever, they think that they just have all the money in the world and they just use it.
How long have you been on WellCare, Debbie?
5 years, I think.
Yeah, me too.
Wow. See, I should have done that 5 years ago, and I've just
But
live and learn.
There's a lot of people that never get online to check. And
it's so easy to just keep with the plan you have. You know, it's like they say it's better to the devil you know than the devil you don't know, you know?
Yeah, but it's a whole ball game. And the reason why your Medicare new handbook comes out.
Yeah. Have you ever tried to read that thing?
Oh, yeah. Oh, come on. I use it all the time. You think it's so that you understand Medicare? They write this thing in May. They have no idea what the numbers are going to be.
It's so should we read that? I mean, what should we do with that book?
It's so that you can market your Medicare Advantage plans. That's what they put at the very end, what the Medicare Advantage plans and what the prescription drugs and special needs plans are going to be in your area, in your state. If you want a Medicare Advantage plan, you need to talk to your doctor. You do. If anybody wants to understand Medicare, I do have 2 books. I've got the Medicare Survival Guide. It's how I got started because a gentleman called Social Security and got the wrong information that cost him $10,000.
I can't believe how fast this time has gone today. We are out of time. So thank you for coming on the show. We will definitely have you back. And you already gave your information, how people can get a hold of you. Debbie, how can people reach you, find out all you do?
MayorDebbie.com, or go to Amazon and search Debbie Peterson Integrity 101 series, and you'll find a whole lot of fun to read and helpful books on how to do better with your local government.
And I'm at caregiverdave.com and on Facebook, Caregiver Dave. But listen, thank you all for coming on the show. I appreciate it. And for everybody who tunes in every Wednesday, makes us the #1 caregiver podcast on the internet. So until next week, same time, same channel. May God richly bless you. Bye bye.